Healthcare workers in the Democratic Republic of Congo who were at the front line of the Mpox outbreak in the east of the country have told the BBC their desperate our team was given rare access to an Mpox treatment center in the country in the worst affected region in the world where infections are rising, yet medical staffs they have no information about when they'll get vaccines, and they're running out of supplies, and they're demotivated. While Simi Jola, who reports as the number of infections rise, the age of the patients gets younger. Little Mula is the youngest Mpox case at Luo's community hospital. At only 4 weeks old, it's an agonizing ordeal. For first-time mother Faraja, it's sad to see my firstborn suffering from this strange disease. I have a lot of pain in my heart. It's a very bad disease. The cries of babies are resounding here. Many are malnourished as babies pass on the disease to their parents. There's fear of a new wave of infections. This is the first time many here have encountered Mpox. I just saw the child get sick. I didn't even know the name of the disease. We can't sit and wait for the children and even adults to die. Bring on the vaccines. Just over 3 weeks ago, this hospital was used to treat all sorts of diseases and conditions, and they used to get around 80 patients a month. But the outbreak got so bad here they had to convert it into an Mpox-only treatment center, and within 3 weeks they've had nearly 200 patients. Remaining motivated is difficult for nurses like Emmanuel, who's worked here for 4 years. Every day he fears catching and passing Mpox onto his own children who are only 7, 5, and 1. It's a sentiment shared by his colleague. You will see that the patients are sleeping on the floor. There's still no staff motivation. Personal protective equipment isn't enough of it. We try to do what we can to look after the sick and not to put ourselves at risk either. This region of the DR Congo has experienced a battle of control over its mineral-rich land for nearly 30 years. The government says it's doing its best to get medics what they need, and the vaccines are coming, but the conflict is making things harder. Because of war, we have over 5 million people who are displaced. The disease can be controlled by good sanitation and good living conditions. Now that people are in camps, the spread will be dangerous. The dedication of the staff at this Mpox treatment center has ensured that there have been no deaths here. They vowed to keep showing up despite the bleakness of what lies ahead. Ayanda shows Zinfo News South Kivu, and we can go live. Really important reporting there from you. There was an interview in that report where a lady talks about not really knowing what Mpox is in the first place. Just talked about first of all the challenge when it comes to awareness. This is the first time many people in Luo, in South Kivu, in these areas of the eastern DR Congo, have come across Mpox. That woman that you're talking about, she said, her granddaughter. She just noticed spots on her granddaughter's body, and the healthcare workers that I spoke to there as well said, because a lot of people didn't know about Mpox, there was a sort of stigma that grew within the community, so people who got sick would stay at home rather than go to hospitals, or they'll choose to go to traditional healers, and that's why infections increased so quickly, because instead of going straight to the hospital, people wouldn't limit contact, wouldn't know the symptoms of Mpox, and wouldn't know what to do when they came across it. But because charity workers, healthcare workers have done a good job of sensitizing, as they say, the community, educating the community about what Mpox is and about what to do when you come across the symptoms, which is to limit contact, to go straight to hospital. That's why the rate of fatalities are decreasing, but they say infections are still increasing. As I mentioned in that report, that once a child gets Mpox, they could easily pass it on to their parents, who would pass it on to the other parents, who could pass it on to colleagues and friends. Mpox is still spreading rapidly within these rural areas, not so much in cities, like where I am in GMA. Walking around, there's no sort of real sense of a medical emergency going on. People aren't social distancing. Though when we got to the airport, there was a massive poster showing Mpox symptoms and warning people to be careful. But that's why it's important that the vaccines arrive quickly, because that would help the authorities contain the outbreak to these rural areas where people are more aware of what to do when they come across Mpox, before it spreads to bigger cities that are densely populated, and that would mean they would need way more vaccine doses than they currently have. Okay, and Simi, let me ask you about the vaccines then. How many have arrived in the country, and what are health workers saying is the need. How much do they need? Around 200,000 doses are in the country at the moment, but they're all the way in Kassel, which is on the other side of the country. The DR Congo is the 11th largest country in the world, so it's far away. But health workers here say they need much more because, as I mentioned, infections are increasing. They're rising, especially in rural areas, especially in IDP camps, where millions who have been displaced are rushing to. I spoke to the governor of South Kivu, Jack Perusi Sadiki, and he told me the ongoing armed conflict between the Congolese army and armed rebel groups in this area is exacerbating the spread. They're seeing thousands of people being displaced and coming into his province, and that again is encouraging the spread of Mpox. So 200,000 doses are in the country at the moment, but the Africa CDC has said millions will be needed, not only in the DRC, but across the continent. They say they have a plan to bring 2 million doses before the end of the year and 10 million doses before the end of 2025. But as we're seeing, the doses are currently just trickling in. Okay, Ayanda, thank you very much for your reporting on that story. Good, thanks for watching. For more updates, like, share, subscribe and press bell icon.